So good morning, everyone. Thank you for joining the webinar. This is Christine So from the Global Health Council. We're so pleased to be able to host today's debrief of the Global Financing Facility meetings that took place in November, the civil society pre-meeting that took place on November 15th in Nairobi, and then the GFF learning event that took place later during the week. We are joined today by members of the World Bank GFF secretariat, as well as by civil society representatives to the investors group of the GFF. We have a great level of participation at this webinar. We have many people signed up, and so we're really looking forward to participation from everyone. Just a couple of housekeeping notes. We will be hearing from the World Bank team and then from civil society representatives, and then we will be breaking for questions, answers, and discussion. We invite people to submit questions or observations through the chat function of the webinar platform. Otherwise, if you are calling in by telephone, please email Liz Colway, who is the person who has been sending out the announcements. Additionally, this webinar is being recorded, and the link and hopefully the download will be available from Global Health Council very soon. So if you want to forward this to other colleagues, or if you know people who couldn't attend today but are interested,
Trouble. Sorry, we seem to be having some technical difficulties. Can people confirm by chat if they can hear us? Okay, great. So Monique, let me turn it over to you for the update on GFF.
Okay, can you hear me now?
We can, great, thank you.
Okay, I'll start from scratch. I was wondering whether you can project the slides on the screen. I can even control it. Great, okay, so I was saying, I'm sorry, people have difficulty hearing me, that you know, the workshop was put together by the GFF Secretariat in collaboration with many of our partners, and so the facilitation and the work on the sessions was done with several different institutions and representatives from the investors group of the GFF. We had over 100 participants from 9 countries and global partners, and there were 3 major topics focusing on the GFF investment cases, the financing strategies, and the country platforms. And there were plenary sessions and a lot of group work was done to particularly allow a lot of discussion around how to take this process forward in the most appropriate way based on the country context. And there were also discussions throughout the workshop. We were together for 4 days around a range of important issues that require additional attention, and this included family planning, adolescence, commodities, and the results agenda. Like I said, we had facilitators from a range of partner institutions, and then there was the pre-meeting that was organized by Christine and Joanne and Mesfin and PMNCH, and in Nairobi beforehand, where 45 civil society representatives were present. So some of the highlights and the challenges that we identified at the workshop. One, in terms of the vision, there was a strengthened understanding for the GFF vision, and all of these summary highlights and challenges are coming from a qualitative survey we did among the participants at the end of the workshop. And then particularly the link between RMNCAH technical work and financing agenda became more clear, and it really helped to have Ministries of Health and Finance in the same room together with CSO representatives and partner representatives to have this joint discussion. There was a very strong engagement and momentum in countries, and particularly also from the Ministries of Finance. That's built on the momentum, and this really is building on the existing momentum and helps to bond and form country teams. Technically, and help to ensure a common understanding of key aspects of the GFF, investment cases, and particularly health financing strategies. And then in terms of partnerships, we were very happy to see the very active engagement from the H4+, all of the UN agencies. So we still have some challenges with engagement on country level by some of the key financiers, and we'll be following up on that. And so this includes some of the key bilateral funders of the RMNCH agenda, as well as Gavi and Global Funds, and also in-country private sector. The majority of the countries prefer to bring more CSO representatives than private sector representatives in their country delegations. For the next step, each of the countries discussed and agreed on their follow-up actions and how they're going to take the work back to the country level after the workshop. And on the global level, we agreed to further work on guidance notes in terms of the operational policies and the investment case, follow up with financiers, and the further development of a community of practice. Next slide, please. Then there were a couple of issues. I don't know whether I can I have the next slide, please? Great, thank you. And so, and on the global level, there are discussions around the quality assurance of the GFF, technical assistance, and the country platform. And we'll give you an update on some of the discussions that took place in Kenya around these issues. And so there was a widespread recognition among the country teams that there is value in an independent QA process. And there's interest in quality improvement throughout the process, so not as the one-off quality assessment at the end of the development of the investment case, and also continue that quality improvement process throughout the course of implementation. And then several countries made suggestions on how they would like to handle the quality assurance. And in Cameroon, they suggested to pair local academics who have worked with Gavi Global Funds with international experts. In Liberia, they suggested to use a QA checklist and then use in-country technical expert review from official and possibly, in addition, a support from an external expert from the region. The proposed next step is to work actively with those countries to develop models for quality assurance that then in the medium term will feed into a decision on how best to standardize quality assurance across the GFF countries. And the nice thing of this approach is really that it's very much country driven, and that those suggestions and ideas are coming from our country counterparts in terms of how the quality assurance process will be designed. In terms of technical assistance, there was a lot of demand for country-driven technical assistance, particularly on the health financing, and a lot of interest was expressed in building capacity at national level to source and coordinate technical assistance and to develop local institutions that can provide technical assistance. So the next steps is TA through the country platform, and so this could be sourced from UN agencies, from CSOs or private sector, and or contracting local institutions like universities. Next slide, please. So the next slide is about the country platform. And there was a strong emphasis from the country delegations on building on what exists rather than creating new or parallel structures. The CSO participants in particular highlighted the value of ensuring that country platforms are inclusive, transparent, and independent, and the need for the GFF to implement minimum standards for the country platform. It was recognized the need to take innovative approaches to engaging the private sector in the country platform. And the major theme was mutual accountability, requires clear definitions of roles and responsibilities of various stakeholders within the country platform. And there's a need for flexible tools to support the work of the platform, adaptable to different settings while ensuring the involvement of civil society and the private sector. And the GFF Investors Group will discuss the country platforms further at its next meeting in February. So, and here the consultation, we found the consultation before the workshop on the Saturday before with 45 of the CSO representatives very helpful, and to further detail the implementation challenges of this type of inclusive approach. And then the final slide is the portfolio update. A lot of people have asked for information on the different countries. We are we are preparing the launch of the website, hopefully early February, which will also be an important hub and base for posting regular updates on country progress. But for the purpose of this meeting, I just wanted to summarize where we are in each of the 12 countries, and so you get a sense of the timeline. Thanks, Christine. I'm going to stop here.
Great, thank you, Monique. So with that, Monique, was anyone else from your team wanting to contribute at this point, or shall we wait until the discussion?
I think we can wait for the discussion, thanks.
Okay, great. Then Mesfin and Joanne, why don't we move on to your contributions? Over to you.
Great, thanks. Christine, can you hear me?
Yes, we can hear you fine, thank you.
Great, okay. So this is Joanne Carter, and I'm one of the 2 civil society representatives on the investors group for the GFF, for those that don't know me. And I'll do a sort of brief update around the November 14th civil society pre-meeting that happened prior to this larger learning meeting that happened in Nairobi. And then Mesfin will speak about some of the civil society perspectives and also interventions in the large learning meeting, and then we can kind of come back to next steps. So on November 14th, Mesfin and myself, again, as the civil society reps to the GFF investors group, convened a meeting with support from the GFF secretariat and also the Partnership for Maternal, Newborn, and Child Health. It was a one-day meeting, a civil society meeting, and again, prior to the learning meeting. And it had, if you can sort of pull up that first, I think, set of bullets that I had sent, so the first slide, just on the specific objectives of the meeting. So the goal was first to really share experiences from the 4 front-runner GFF countries on civil society engagement in the process, in the development of the RMNCAH investment cases and the health financing strategies. And then the really key piece of the work of that day was also to develop and refine a really strong set of minimum standards for stakeholder engagement in the GFF country platform. And I think it's important to note that those minimum standards were not minimum standards just for civil society. They're minimum standards for all stakeholders. And the initial goal was to be able to have those ready so they could be and really refined and endorsed by the people in the room so that they could be brought into the larger learning meeting and shared, but with intention then to obviously take them forward further to the investors group and to the folks that are working on the country platform paper that you heard that will also be presented to the investors group in February. And then we had some time to also discuss how those minimum standards could be practically implemented in the GFF countries, and really more generally how we should be beginning to figure out how to coordinate together communications, but just sort of broader coordination of civil society. And that meeting had, as you heard, I think from Monique, it was 45 civil society representatives from 13 countries. That included civil society representatives from 10 of the 12 GFF countries, as well as representatives from the region, kind of regional reps, and some global partners that have been supporting GFF work. And there was a set of kind of, I would say, a combination of key findings or conclusions, and then also recommendations from the civil society meeting that were both brought forward into the larger learning meeting that happened the next 3 days, but also are intended sort of for broader dissemination as part of this process. So I think the first kind of finding was around civil society engagement in the GFF to date in the front-runner countries. And, you know, there were different experiences, and there's a set of notes that detail some of the feedback from folks who were from the front-runner countries, and you can see more details of what their experience was. But broadly, I would say that civil society engagement across those front-runner countries had been quite variable, but many of the civil society organizations, the folks there, expressed that there had been, you know, a good bit of challenge, like little exposure to the GFF, limited communication, and sometimes, you know, I think early on in this process, lack of clarity on some of the processes and opportunities for engagement, sort of unclear how CSOs were selected. That seemed often relationship-based, and it wasn't necessarily coming from sort of civil society selecting representation. You know, often that there were challenges in terms of having notice for meetings and deadlines for feedback. And then also, I think, you know, a challenge for civil society in having some of the resources to, and staff time and travel capacity to participate fully. And then I think, you know, at least a strong view that we need to make the case, and it needs to be understood, just the value kind of in the many ways that civil society brings to this, because the importance of civil society engagement isn't for political correctness. It's, again, because of all the value that civil society brings, and, you know, trying to ensure that we also highlight that and sort of take advantage of that ourselves. And you know, I think some of that did come out really helpfully in the larger learning meeting, and Mesfin can speak to that. But I think, you know, areas for us to look at in terms of civil society value add, you know, it's obviously knowledge, all of the knowledge we bring about the issues, and including at subnational level, including for hard to reach populations, and issues that sometimes get too little attention, like adolescent, you know, reproductive health and others. But also, I think the capacity for civil society to provide technical assistance around planning, around implementation, again, around reaching hardest to reach populations. The really important independent accountability role we can play, the role I think we can and need to play in enhancing communications to a broader set of stakeholders. So again, as I said, a big part of that meeting was further developing and refining a set of minimum standards for, again, for all stakeholder engagement in the, you know, in the country platforms, not just civil society, though obviously really important for civil society. And again, you can review those minimum standards in detail, but I think, you know, what we worked on was how do we sort of build out around the principles of, you know, the sort of first two principles that were sort of built into the original standards, and then how do we add standards of independence and accountability. So it was adding some specificity really around the issues of inclusion and transparency, and trying to help make that operational, because again, I think this came out in the learning meeting, the fact that the GFF is not proposing one way for country platforms to operate makes it in many ways all the more important. You know, it's not suggesting that there be one form that this country platform takes. It makes it all the more important that we're really clear on those minimum standards. So it was kind of developing out more specificity to really operationalize the transparency and inclusion, but then also adding independence and accountability as critical additional elements at country level. And that includes, in terms of independence and accountability, that includes proposals for kind of a joint review of both government and independently provided reports on GFF results on an annual basis, but also an independent annual review of how well countries are adhering to minimum standards. And I think it points to, you know, one of the key areas being developed for the GFF, in addition to work directly on the country platform, work around what quality assurance will look like, and not just quality assurance up front, but quality assurance kind of on an ongoing basis. And it will be really important that really seeing how adherence to these minimum standards is part of that quality assurance. And then also, we raised, and I think still really needs to be sort of wrestled with and sorted out, what kind of redress mechanism is there? What kind of mechanism is there? If, the ideal is that obviously countries would embrace this and we would take it forward, but we do need mechanisms and places to go if this is not working, and that there's a way to respond to that. And so again, in terms of the work around the minimum standards, the goal was initially, as we said, to bring it into the larger learning meeting, but then also we'll talk about next steps about plans that Mesfin and I will kind of be the point people for also taking this to the GFF Investors Group, and also the technical working group that's working on developing the country platform paper, though, again, we were part of those discussions in the larger learning meeting. Just a couple of final points. In terms of some of what was in those minimum standards, one of the key points we made and want to continue to make is there does need to be multiple CSO representatives on country platforms. So it really isn't possible to just have one person represent all of civil society in a country. It will be important to have the space for multiple representatives. And then it will also be important for those representatives as chosen by civil society, ideally, that those representatives will need to have the capacity to represent networks of civil society in country and have some of that capacity. And then a point related to that, it will be important to ensure adequate resources for CSO engagement, particularly at country level. And we don't yet really have a process for directly financing those civil society activities, but it's obviously going to be key if civil society can play a really engaged role as stakeholders in country platforms for there to be resources to do that, and that the recommendation is that some resources be set aside at the central level for CSO engagement so that they can be accessed directly and folks aren't necessarily having to depend on or wait for governments to disperse a percentage of, say, the country funding for that. And that we need support from the sort of GFF Investors Group and Secretariat and other partners to be seeking complementary, independent funds, particularly for civil society-led accountability. And then the last piece, which I think we should come back to for longer discussion, is there was a very strong view on we needed enhanced communication about the GFF. So that comes both from the Secretariat, which I know is working on a website and really I think, understands the value and need to get out information on where countries stand on the investment cases that have been developed to date, et cetera. So working on that, but also ideally a separate sort of site that isn't, in addition to GFF Secretariat site, a separate site for civil society to share information on the GFF. And then also the value of a kind of coordinating group of civil society from country level in the GFF countries to regional to global, working together to kind of share information in real time. And again, there are some good models of that, I think, particularly around the folks that have been working on reproductive health. I think have been doing some of the best work on that. There have been partners like Global Health Council that's leading this call that have been really supporting getting the information out, PMNCH, but kind of coordination among partners, and that really goes from country to global level to be sharing information in real time. So I think I'll stop there and turn it over to Mesfin to describe how these recommendations and discussions were brought into the learning meeting, and then we can come back to next steps. Thank you.
Thank you, Joanne.
Okay.
Mesfin, yes, over to you.
Okay, thanks, Christine. Thanks, Joanne and Monique, for the overview about the GFF main learning as far as the pre-learning. Hello, everyone. My name is Mesfin Teklu. I am one of the civil society IG member in the Global Financing Facility. Can you move to the second slide? How do I move? Okay. So I think many of the points have been mentioned by previous speakers, but I will be focusing mainly on the main learning event, specifically from the civil society perspective. And the main learning event was a big gathering, more than 100 participants from the frontrunner as well as second wave countries. And part of smaller number of civil society who participated in the pre-learning meeting on the 15th also joined the main learning event as part of their country delegation. So we have 9 participants as well as myself, Joanne, and a participant from the PMNCH. So in terms of the topics and the major themes that was covered in the main learning event, I think you've heard of the issues around investment case, and I think this has been a learning for many participants as well as to understand the process in terms of how countries are developing investment case, which is built based on a sustainable health financing strategy. So, traditionally this may have been done by health economists, or, but I think understanding the process in a way that is inclusive of all the issues that need to be taken into account along the RMNCAH agenda is quite instructive for many participants. And the discussion focus on technical areas, how to develop an investment case, issues around health financing, and the other part was country platform, where we got the opportunity to present the minimum standard. And again, apart from this cross-cutting team, there has been also specific discussion on specific issues around, adolescent health and family planning issues, commodities, health financing and learning from implementation. This was a learning event, and I think it was learning from the countries that have done this work, and then how it has been done, and then what has been the learning through that process. And we had a very long, presentation from Kenya in terms of their plan for improving their civil central registration and vital statistics, and then how that information would be helpful in terms of addressing issues of, maternal, newborn, adolescent mortality, health issues, and access to service. And it's part of, the right to health, and it's a way, ensuring that actually everyone have access to those services. So, these are the main areas of focus during the 3.5 days session. And through that process, the country team have been able to understand actually what it takes to develop this plan, and many countries are actually developing their investment case from existing plan. For example, I was part of a working group with the Uganda country team, where they actually use the existing sharpened RMNCH plan into looking at the issues along the continuum and using the investment case development process to address issues that has been historically neglected, like family planning and adolescent health issue. So the learning has been actually very helpful for many participants in terms of understanding the process and improving their country investment plan. Next slide, please, Christine. As part of the civil society, our main objective was to take the learning from the civil society pre-learning meeting to inform the broader learning process. And we have developed, we developed a key speaking point for our civil society participants in order for them to be able to articulate actually in terms of sharing from the country discussion, because the people who come to the main event, everybody was not able to come, only one civil society per country team. So in terms of civil society engagement thus far in country platform, I think Joanne mentioned about the variation of engagement thus far and how those engagement could be improved. And then just highlighting the issues around the role of civil societies in terms of contribution to the GFF, whether in the form of improving accountability and perhaps service providers reaching to hard to reach population, and as well as their presence in subnational and local areas in terms of providing service as well as technical assistance for investment case. So we also took the opportunity also to present the minimum standard for meaningful stakeholder engagement, and this was pretty much our central message in terms of stakeholder engagement. In order to enforce the country platform, really there needs to be a standard. I think the civil society group spent significant time developing those and clarifying those standards, and I think it has been received well to strengthen the country platform. I think Joanne talked about the communication and the resource. I will not repeat what has been already said. I'll move to the next slide. And again, civil society organization had the opportunity to speak at different panels. This is one panel where two of our civil society participants or representatives shared their experience from their country platform. The far right side, Dr. Emmanuel Abinida, who is Executive Secretary of Health Reform Foundation of Nigeria, and as well as the third, the lady in the third from the right side, who is from Uganda National Health Consumers Organization, Robina. And both of them shared their perspective, how the civil society engagement has been thus far, and both Nigeria and Uganda are on the second wave. But I think both of them have had experience in terms of the early stages of how the countries has been reaching out and engaging stakeholders on GFF process. And I think that has been helpful in terms of sharing their experience as well as learning from the others. And other civil society participants also had the opportunity to participate in other panels where the country platform paper was presented. I personally was able to speak in the opening as well as other panels where I was able to share the outcome from the civil society pre-meeting in terms of the key issues that we outlined from our discussion. Next slide, Christine. So just coming back to the minimum standard, I think overall there was good reception to those standards, and there was feeling that there is a commitment to strengthen effort around inclusiveness and participation, particularly for CSO and private sector. I think the minimum standard have three sections. One is certainly on inclusiveness and participation, and with a clear outline of what does that mean practically. And there is quite overall recognition and on the importance of this in terms of strengthening the country platform, especially on the engagement of CSO and private sector. And we've also seen, in the discussion, of course, during the country platform discussion, large agreement on the transparency-related request, publishing the minute and sharing documents for the country platform discussion, and how different materials, including the investment case, should be published and available for public comment. I think those has been widely received. I think quite a good agreement in terms of improving transparency. But there was little discussion on the accountability. Perhaps maybe this was a challenging part in terms of how to ensure independence and accountability of the country platform. And there are quite a number of recommendations included in the minimum standard and there has not been enough time really, that these issues to be discussed. And I think, we felt like that was not covered adequately, and perhaps maybe that's something that we'll be taking forward between myself and John in the broader investment group discussion. So at the same time, in the same group of country platform discussion, there are quite a number of proposals made by the country team in terms of quality assurance to include, independent assessment of the investment case and the process around development of the investment case. I think those are good suggestions that was put forward in terms of ensuring actual investment case actually meet the quality standard, including the process of development as well as the outcome itself as a good quality investment that would build the confidence of all partners that participated in the development process. And specifically, Nigeria even specifically noted that the minimum standard were actually largely being applied in their context, and their assessment was actually, they are very much decent, and I think, they feel like that this minimum standard would help them even to further strengthen their country platform. So we kind of feel like that the countries are actually seeing the benefit and value of this minimum standard. We hope to see this being used and applied, and I think that would be something that the quality assurance process needs to look at as the investment case and the health financing strategy and country platform process are being evaluated. Next slide. So, overall, I think my takeaway is that, the GFF in general thus far has been developed and shaped with full participation of countries. I think, there has been a strong emphasis that, although GFF has a business plan and a guidance in terms of how the GFF should be operationalized or implemented, but I think it has also been informed by the countries that are already at the front run in terms of developing investment case and health financing strategy. So throughout that process, as long as it is good that, we are learning by doing, and also there is a recognition on the need to engage multiple stakeholders. I think there is honest acknowledgement that the process so far has not been that perfect, and there is quite a lot that need to be improved. And the comment and the feedback we heard from the country teams that as much as they would like to engage many stakeholders and they want to develop a stakeholder engagement plan, that has not been the case thus far. So I think there is honest acknowledgement of the gap, and there is we felt that there is a commitment to be more inclusive and use some of the tools that's being developed for GFF implementation. And I think overall, the country platform is really at the center of GFF, and that's where all action and everything come together and see light actually. And I think that's where we kind of see that the opportunity as well as the clarity in terms of how that platform function, both in terms of the stakeholder engagement as well as the process and the quality assurance, the technical assistance that is needed to really develop a meaningful and robust investment case that will address RMNCAH issues in equitable manner. So that's our should be our central area of focus in terms of supporting countries. And of course, at the moment, country platform exists, and countries are using their existing platform, but there is a desire as well to strengthen those existing platform. The existing platform has been established for various purposes, and looking at GFF and the whole objectives and addressing the issue of RMNCAH across the life course, I think there are rooms and place for strengthening them, and we feel that and also strongly recommended that the minimum standard would provide the practical tool to make them stronger. And of course, we provided key recommendation to support effective functioning of the GFF. I think that's something that's taken forward. And I think in general, there is a realization that the GFF has served as a catalyst to bring focus on issues across the continuum of care, including areas that has been traditionally neglected, specifically on issues around adolescent family planning issues. And I was part of a group, as I said, in the Uganda country team, and I think it was quite clear that by going through the process of developing investment case, they have been able to identify gaps in their existing, what they call a sharpened plan, and they have been able to bring up issue that has not been part of the country plan in their previous strategy. So I think we see that GFF has the potential in terms of bringing to light some of these issues that have been neglected for a long time. There was a need and also recognition of need for capacity building, especially around health financing, investment case development, and as well as country platform. And this is the area where technical assistance is also expected. I think countries have actually expressed the need for this kind of assistance and requested in kind of a community of practice approach in terms of supporting the countries, and also a recognition that those capacities do exist at regional and country level. And then the GFF actually success is dependent on how much is able to mobilize and use those capacities to support countries. So overall, there is general realization that this is an opportune moment for us to be able to seize this and do better in terms of the existing platform, using the principles and as well as the tools and the process that are being developed in order to support the GFF country platform. So quite positive experience in terms of the learning, and also appreciation and identification of gaps in the current process that need to be strengthened. I think the investment group as well as the country team have a role to play in the coming year in terms of supporting countries who are actually going forward with the development of this plan as well as implementation. Next slide. I think this is the last one, I believe. Next slide, Christine. Yeah. So just just to say that I mean, it's been great in terms of being part of the country team and working with our country colleagues, myself and Joanne. And I think in general, there is a kind of a sense of realization that the civil society actually who came from the countries, the need for communication, the need for resource, the need to be connected with a global network in order for them to be able to engage meaningfully. And although there has been challenges, I think they are also seeing that the opportunities are also there for them to be able to support and strengthen this country platform. So we have outlined a number of key next steps and actions that we will take forward as civil society organizations, and perhaps I'll come back to that in the next level of our discussion. I'll stop here, Christine. Thanks.
Great, thank you so much, Mesfin. So I think that we've had really good presentations from Monique from the World Bank and from Joanne and Mesfin. Right now we have time where we can take comments or questions. So I'm going to ask Liz to let us know what we've already received and also to let us know more about the logistics. We will take probably 2 or 3 questions initially and then ask for input from the World Bank team and from Joanne and Mesfin. And then we will go on to the next questions. So Liz?
Sure, so just a reminder, if you want to use your chat box on the bottom of your screen, you can send questions to us that way. And we do have a few questions that have come in. The first question is the GFF really new funding, or is old money dressed as new? And then another question that we have coming in, how does this group link with the others in IHP Plus Gavi and GFA-TM and reduce processes that may overburden countries? So those are our first two questions.
So Monique, why don't we go to you? And I know Rama is also on the line. I'm not sure if Diane is there, but why don't we hear from you first?
Great. Can you hear me?
Yes.
Christine, can you hear me? Yeah? Great. So thank you for those questions. And so Rama's on the line too, and Diane as well. I'll start with the first question in terms of the funding. And so I think here it's important that there's different ways in which the GFF tries to look at reducing the financing gap for women and children. And so one area of focus is really ensuring that current resources are better used. And we made the estimation based on evidence in the literature that there could be about a 15% increase in efficiency of use of resources. And that applies to any type of resources being used for women and children. So this could come from government resources or from donor resources, multilateral or private sector resources. And so that really improving the use of existing resources is one area. Then the trust fund money and the IDA associated with it is mostly newly allocated. And so, for example, many of the GFF countries were not planning on having an IDA allocation for RMNCH, but in the process of assessing their interest and the opportunity to also get joint financing from the trust fund created a demand to then also allocate IDA to this topic. And then finally, it's not just the IDA and GFF trust fund financing. We're really looking at aligning and doing the complementary financing from the other financiers to the bilateral programs. And some of that is reallocations of existing, and for some of that funding, it's new funding, and so it's really a mixture there. So that's on the first question. Christine, the second question was around the alignment with Gavi Global Fund, right?
Yes. Yes.
Yeah, and so I mean, this is an area where we have quite a lot of experience in the previous program that focused on results-based financing, and really working in a very collaborative way on country level takes advantage of the comparative advantage of each of the partners, and so this is really a very important part of the partnership around the GFF, and is the reason why the Global Fund and Gavi are also key partners on the GFF Investors Group. We're in the process of discussing where the opportunities are in the 12 initial countries funded by the Trust Fund to really further develop this collaboration on country level. I mean, like I said, we have a lot of previous experience doing joint missions and developing joint programs, bringing in the financing for the specific areas. And so when we look at a very comprehensive package of services for women and children, the Global Fund can come in funding the HIV, AIDS, TB, and malaria, and the World Bank can fund some of the, through the GFF angle, fund some of the other services. And this type of collaboration we've successfully been doing in DRC and Benin and Burundi, and we'll be further building on that successful experience. Thanks.
Monique, can I come in? Sorry, this is Rama.
Yes, please go ahead, Rama.
Please.
Hi, yes, I just wanted to say, in addition, I think just as Monique was saying, this is a partnership, and you know, Gavi has also got a partnership engagement framework, and we are working closely with them. Particularly, they are concerned, as there is graduation, and so too Global Fund, about the financial sustainability angle of keeping the investments that they've already made, whether it's in immunization or on the other diseases of the Global Fund. And so again, I think the Global Financing Facility is a great opportunity, since it looks at health financing from the sectoral viewpoint and not just from one aspect of it alone. Thank you.
Thank you. Joanne, Mesfin, anything to add?
This is Joanne.
Just, Christine, on the CSO perspective as well, I think in terms of the financing aspect, Rama and Monica has explained well, we are also working with civil society network from the Gavi and Global Fund in terms of harmonizing actually our advocacy and engagement at the country platform. So we are reaching out across the these different financing arm where civil societies are engaged in terms of the advocacy or service delivery. And I think, you know, these all come to the country platform where all the stakeholders come together. So we are working toward this in terms of harmonizing our engagements through that process, and I think this is a process that is in place, and we hope to have some sort of, you know, coordination mechanism to ensure that actually the communication, the engagement is consistent across the platform.
And I would just very briefly add that I think we're also looking at, you know, trying to identify where are some successful examples of sort of country civil society platforms. So that includes Gavi civil society platforms in some countries, strong civil society engagement in a well-functioning country coordinating mechanism for the Global Fund, as ways to learn lessons that we can take to sort of GFF for around the country platform and around civil society engagement. And the only thing I would say is really reinforcing from a civil society perspective what Monique was saying. I do think that there is a huge opportunity in GFF that countries get an allocation for IDA. I mean, they get a certain amount of money. I think to be able to have incentives of the trust fund that would encourage them to invest more of that IDA funding in health and in RMNCAH specifically, and nutrition, is a real opportunity to increase the pool of funding for health and for these specific health areas.
Great, thank you. Okay, so let's go to some additional questions. We're getting lots of questions. We will try to handle as many as we can on today's webinar. We can also post all of the questions that we've received and invite commentary after the webinar, since we may not get to all of them. So Liz, do you want to go to the next ones?
Sure. So I posted some of the questions on your screen. The next one that came up was, does the team really think CSOs can influence the agendas? This individual remains skeptical, as agenda driven by the World Bank and WHO and others. Can CSOs set any of the agenda? And then another question that came up is, can you say more about the discussion on commodities? Also, is there any scope to arrange a study tour for the Asian representative? And then the last one on your screen, what has been the discussion on financing nutrition interventions with the GFF resources? What is the guidance on nutrition interventions which are necessary for decreasing neonatal and child mortality?
So let's start with the bank team. Monique?
Yeah, so I mean, maybe I'll do it from the bottom up. So in terms of nutrition, it's fully integrated in the investment cases, and in terms of the financing, and there's a lot of interest. I see a lot of momentum in the currently funded GFF countries for the nutrition issue. I think it's much better if it's not financed separately but integrated, because I think it will be able to lever not just trust fund money but also the IDA funding. We're also working very closely with the Power of Nutrition. Some of you might be familiar with them. They're based in the UK, but there's also a small trust fund at the World Bank, and where the Power of Nutrition is sort of following the same pipeline as the GFF. And so in many of the countries like Tanzania and Ethiopia, potentially Cameroon and DRC, we will have specific nutrition funding that will fund the nutrition part of the investment case, but the financing streams and all of that will make sure that it comes as one pot for the government. So very exciting on the nutrition, and it's really, I think, ramping up the attention on the nutrition agenda. I'm not sure what's meant with the study tour for Asian representatives, but we do have India and Bangladesh, two of the GFF countries. They felt it was a little early on in the process to participate in Kenya, but at the next event we absolutely expect those countries also to send their delegations. In terms of study tour, before I know about what the focus would be of the study tour, maybe the person who asked the question can clarify, and then we can talk about that. In terms of the commodities, I mean, obviously that's an extremely important agenda, and we're also building on the experience of the RMNCAH Trust Fund and the life-saving commodities work that has already taken place. This is an area where, from the World Bank perspective, the partners have a lot of comparative advantage, and so we're working closely, for example, with UNFPA on the commodity security funds, and really looking at how in that partnership we can jointly finance for UNFPA the commodity part, and for us the service delivery and the supply chain arrangement part. And so lots of opportunities for partnerships there, and a really important agenda. I think the CSOs are very much already influencing the agenda. That's my perspective. I think the two representatives on the investors group are very active and opinionated participants of the GFF governance process, and I think that's really great. On country level, I see it's a mixed picture, like Mesfin was also presenting in his part of the presentation. But I think that, you know, in the discussions we're having around the country platform, there's a lot of opportunity to have a more structured approach to that. And so my answer to the question will be yes. You are influencing the agenda to a large extent, and we could. I think we could jointly even strengthen that. Thanks.
Thank you. Mesfin, Joanne? Joanne, do you have any?
Hi, this is Rama.
Oh, Rama. Hi, sorry. Please go ahead.
Rama,
Sure.
go ahead.
Thank you. Yeah, thank you. I just wanted to say that, you know, just to add on the nutrition, as Monique pointed out, it's very well integrated, and in fact, part of the business plan is to look at some of the key multi-sectoral issues that impact on health, because as many of us know, almost 50% of the health gains are coming from outside of the health sector. So nutrition is definitely a key piece. And I think also for the World Bank itself, given the intergenerational effects of nutrition and its impact on poverty, it's also even more important that we integrate it into our RMNCAH work. And again, I think to reinforce what Monique said about CSOs influencing the agenda, I really have to say that the perception that CSOs are unable to set the agenda seems kind of 10 years behind today, because definitely at the bank we have a CSO representative group that goes also looking at health. There is also those that look outside of health, and they are taken very, very seriously, because they are very serious professionals who are engaging with us on these issues. So for us, I think we are learning a lot from this engagement, and I think the agenda is definitely a shared agenda. Thank you.
Joanne, Mesfin?
Yeah, Christine, let me just offer a few comments. I'll start from the top, perhaps. I think in terms of the CSO role and influence on the agenda, I certainly share the previous comment in terms of CSO's ability to influence the agenda. I think historically, you know, civil society, when we come together and work together, we are very much stronger and be able to influence agenda. And I think there has been quite a strong evidence, you know, in many of the multilateral processes. In the GFF process, you know, during the business planning, civil societies has been actively engaged from the very beginning, and continuing with the investors group, and we certainly have the same voice like any one of the investor group participant in the investors group. So we do feel like that we have a space to influence the agenda. We do contribute into the outcome and deliverables. I think the challenge is certainly the experience thus far at the country level is still at the early infancy stage, and there is still more work need to be done in terms of bringing up the voice and role of civil society in that platform. And it's our ability to bring together people working across the service area of RMNCAH, including the vaccine, HIV, and maternal child health and nutrition, and be able to have a representative that represent the constituency, be able to articulate what is the priorities. And I think civil society's role in terms of accountability, tracking resources, and bringing the citizen voice, I think those are the areas, and of course other in terms of the technical area of work where we think we have a role to play. And I don't underestimate the capacity of the civil society to influence agenda. But again, it's not yet there, and we have work to do, and I think the process has just started. So that's what I can say at this stage. In terms of the discussion on the commodity, I was not in that particular group, but I think the key thematic areas were running in parallel. I was in the adolescent group, and I can't say much on that topic, but when the meeting report comes out, we'd be happy to share with everyone so that you know what's being discussed in that group. So that's you know, my comment, and I think the other questions are being adequately addressed by others. Thank you.
Just Joanne, a couple of quick comments. So starting on the nutrition piece, I will say you know, it has also been really important and valuable to have civil society engagement on that even to date. You know, I think it's clear in Kenya that part of the reason that there is nutrition included in there has been the role of civil society in helping make sure that that happens. So I think the engagement of civil society and Sun platforms will be key. I think we need to be proactive about that. I think there is an absolute recognition, and it is embedded in there. But I think for all of these things, to make sure that all of those pieces get included will take everybody's attention. I think there's every intention of doing that, but it will take everybody's attention. And I think civil society can play a key role in that. And it's, again, why it's really important to more broadly include also the Sun civil society and other civil society partners working on nutrition, but also the Sun platforms overall. Just on the, you know, I do think we're also committed, and it will be really important to make sure that we're engaging directly and actively with civil society folks in India and Bangladesh as those countries are coming online as sort of second wave countries. So I do think there's ways we can also support that. And then just on the whole issue of civil society, I think Mesfin said it really well. I think we have the, you know, we have had some influence and we have the potential. I think always challenging the process and challenging us and a healthy skepticism is not a bad thing to kind of make it go better. But I do think it's why, especially at country level, the minimum standards are so important, and why civil society being joined up kind of from the local to the regional to the global level so we can support each other in ensuring kind of active engagement of civil society at country level is really maximized. And as Mesfin said, I think really key role in accountability, including independent accountability on some of these issues, but also I think really important role in technical assistance. You know, civil society as actually, you know, some of the best folks in providing technical assistance around how to reach hard-to-reach populations, you know, around accountability, around some of these key areas that are neglected.
Great, thank you. I think we're going to go on to our next question. We have 3 questions that are each around a particular theme, so I'm just going to read one of them and ask for comments, and then we'll do the 2 individually that follow. So the first question is around system strengthening in fragile states. Specifically, the question is, implementation of a system strengthening approach in fragile contexts often requires unique national to local level analysis, built-in learning, and flexibility of funding and objectives. How is the GFF taking on these challenges in countries like DRC, Liberia, and Nigeria? At a higher level, can you outline the proposed processes to examine, assess, and adjust the fit of the GFF to the unique realities of fragile contexts? So Monique and Rama, over to you for the first commentary. Thanks.
Great, thank you. That's a really important issue, and so thanks to the person to raising that. So it's been really acknowledged that even at the moment, a large part of the agenda is in fragile states. Over time, while a lot of the low-income countries become middle-income countries, more and more the group of countries that will continue needing support are fragile states, and so our ability to be responsive there and effective is going to be very important, and this has been recognized also by the GFF Investors Group. So there's a specific task team that has been formed to look at how to modify some of the GFF approaches in fragile environments. And this group will particularly look at some of the existing countries like Liberia and DRC to further tailor the GFF approach to the needs of those countries. And Mesfin can talk more about, he's a member of this group. It's just been formed, and so that work has only just started. But it's going to be very important in preparation for the February Investors Group meeting.
And maybe just to add on, this is Diane, sorry. And of course it will build on a lot of the work that's been done in the context of Every Woman, Every Child, and taking care of women and children in fragile and humanitarian situations. So there's a lot of work that's been done on that, and so we're hoping to build on that and other global processes that have thought about these things. So we won't be starting from scratch.
Great, thank you. Joanne and Mesfin?
Christina?
Or who? Yes, please go ahead.
Hi, Christine. I'm not sure if someone else was speaking, but yeah, just agree, I think, on that question. It is something that the GFF is actually taking up in its work plan. And I think as Monique put it, there is a work group that's being put together and to help GFF in terms of developing the business process for supporting countries in fragile contexts. And DRC have had experience of implementing pool funding for reproductive health, and certainly I think there is quite learning from there. In fact, actually many of the thinking for the GFF business plan was informed by the experience from DRC. So in fact, the fragile contexts have actually already contributing to the learning of GFF, but we do acknowledge and realize that this is, different context, requires flexible model, and perhaps this is where we need a unique approach. So at this stage, very difficult to say much because the work has just started, the group has been formed. So hopefully we'll provide you update after the next investors group meeting to understand where we are on this piece of work.
Thanks, Mesfin. Joanne, did you want to add anything?
No, let's keep going. There's a lot of good questions. So.
Okay, great. Well, then let's move on to the next question. We have had a lot of focus on civil society organizations that are important for governance, accountability, voice, etc. I'd like to hear what is planned for the private sector, insurance and providers. In countries like Nigeria, for example, where over half of health service delivery occurs in the private sector, it would seem that for practical financing reasons, this sector is critical. Or are we assuming they have nothing to contribute in terms of experience, or they will just be expecting to play whatever role we think best moving forward, or no role? Monique?
Oh, hi, Christine. This is Diane. I'm going to take
Sure.
this one. So I think, firstly, the idea is that the private sector will play a very large role, and as a public-private partnership approach, we're engaging them on a number of levels. The investors group is actually going to consider a private sector strategy at the February meeting. So there's been a lot of thought and preparation on that, and there is a group that's working on developing an approach. And we're also taking it from a very practical grassroots kind of idea of making sure that we have some models that work in country. And Nigeria is certainly one of the countries that we're looking at what's already been happening and how we can build on that into, and replicate some of those activities in other countries. So the idea will be, rather than having a philosophical discussion about the role of the private sector, we're looking at practical examples in as many countries as we can, and looking to see what models we can put forward for countries to consider as part of their investment cases and as part of the approach. So there'll be a document that will be circulated with a task team of the investors group, and then we're hoping to have a much broader consultation in late January with many private sector companies, again focusing on companies that are active in country. And as you know, we have private sector representatives on the investors group, including the CEO of Safaricom. So we're focusing on countries that can actually engage at the local level and bring their expertise to bear there. And this will be obviously quite a complex undertaking, because there are like civil society, the private sector is huge, wide, and varied, and has different skill sets. There are providers, there are pharmaceutical companies, there are device manufacturers. There's a very wide range of potential contributions and very different ways in which that can work, including, and we're looking at a lot of innovative finance in this space as well. So it's a very broad agenda. I think our challenge is going to be how to prioritize what to do first and what to do that will have the fastest impact. And so we'll be looking at short-term, medium-term, and long-term ideas about how to engage that sector. And I think this is also, you've had a little bit of a discussion around engagement of various actors at the country level and how to be transparent about that. And many of the transparency and accountability issues you've been discussing for civil society's engagement apply also to the private sector. So we'll be looking as well to make sure that countries are actively engaging those stakeholders and in ways that are really rapidly moving the agenda forward. Thanks.
Thank you, Diane. Mesfin and Joanne, do you want to add anything in terms of how some of the discussions at the investors group or civil society discussions may have been also thinking about that diversity of the provider base and the fact that people do access so much of their care from private providers?
Hi, Christine. Yeah. Hello. Yeah. So yes, I can make a few comments on that. And I think, you know, in this call, we focused on the CSO engagement and role, but that doesn't mean that the role of private sector was not recognized. In fact, in the May learning event, there was quite a strong kind of, you know, comment as well as participation of private sector. And there was one afternoon dedicated for that, which was facilitated by the private sector IG member, and recognizing how the private sector can play significant role, and knowing that they are the major service providers in many countries. So the GFF is actually one of its mechanism of raising additional resources through innovative financing, which is basically working with the private sector, using whatever instrument use the private sector, the insurance or the others or the capital market. Quite a number of options that's being produced, and in terms of innovation and improving or overcoming bottlenecks, a number of issues that be identified as private sector could contribute in terms of the GFF objectives. So I think it's clearly articulated in the business plan, and I think Kenya perhaps maybe the countries that have advanced on this area in terms of engaging the private sector, and the other countries also actually during the learning they see the potential and the role of private sector. In fact, one of their take-home message from the learning was how to better engage the private sector and the civil society in their investment case. So the learning was very helpful for countries to see where will be the role of private sector and how much contributions they are making, and appreciating that in places like Nigeria, I think it was reported that nearly 70% of health services are provided by private sector. So there is no way that the health financing would consider anything less of private sector. And the other thing is also, when you talk about health financing for health, I mean, as public sector, we all sometimes think of what's coming through the public financing, but I think the whole envelope needs to look at the role that multiple stakeholders, including private sector, are bringing to the to the financing and as well as the service delivery part. And I think my observation was basically, this is critical stakeholder. They just want to understand a little bit better how to engage the private sector, and I think that is something that the countries also expect in terms of support, in terms of engaging the private sector, and I think that's my general observation from the learning event. Thank you.
Thank you, Mesfin. So Joanne, would you like to add anything here, or shall we go on to the next question? Let's see, we're not hearing Joanne, so I'm just going to go on. The following question is around technical assistance. Can you speak more to the resources countries can access related to technical assistance in developing investment cases and financing strategies and implementing them? Is there any more information on technical assistance mechanisms and how partners can support this process? Monique and team?
Okay, yeah, thanks. Very important question. So from the Kenya workshop and the discussions there, and I think we summarized that also, I just refer back to that slide, but as part of that discussion, there was a very clear demand for country-driven technical assistance. And so the country teams are saying we're in the leadership position and we're driving this process in country. We want to be in a position to then identify, as part of those discussions on the country platform, what the technical assistance needs are. There was a very strong request, particularly also on the health financing, to invest and support activities that build the capacity of local institutions. And this is particularly important when you look at the GFF long-term agenda in terms of sustainable financing and the institutional capacity to work on those issues over a period of time where also it's expected that some of the external donor financing will decrease. And then finally, many of the countries said that they, as a first step, will try and source any additional need for TA through their country platform. So whether it's from local institutions or CSOs, private sector, from the UN, different sources that they have in country, and then if they cannot source it in country, they will look to for global technical assistance. Thanks. I think Rama has dropped off, so that's our contribution.
Great, thank you, Monique.
I'm here, but I think you covered everything.
Great, thank you, Rama. Joanne and Mesfin, do you have anything you wanted to contribute around technical assistance?
I think first to say that there's a really key civil society role here, and I think there's a whole bunch. Well, I guess even before that, I think strongly endorsing, and I think a case that we've made in the investors group is that the civil society, that the technical assistance really does need to be of the nature that it supports really building capacity, country capacity and regional capacity, and country capacity, but also subnational capacity, and that's sort of really key. And then within that, I would say that, I think we need to be quite proactive with a set of strategies about how civil society can engage on that, because I think, again, it's about things like reaching groups that are hard to reach. It's about accountability. I think it's about a lot of work devolving to the subnational level where there really isn't capacity, and it's one of the places where I think civil society organizations do really have capacity to add on this in terms of implementation, accountability, and then I think a key civil society role in thinking smartly around health financing strategies, especially health financing strategies that are equitable and protect the poorest. So I think some of that will be really key, and both to support that at a global level, but to be really looking at how we can ensure that there are explicit and strong TA flows to civil society, and I think the Secretariat is also wanting to be quite supportive about that as well. And I apologize, I got cut off, I think I disconnected myself before when we were talking about private sector. So I would just, the one very quick thing I would add is just on the private sector, like others, I think having, again, not to sound like a broken record about the minimum standards, but having a real good stakeholder engagement plan to ensure that proactively all of the key players are being engaged is really key to making that successful. And I do think as well that I think it is really important that in the case of the GFF, that the private sector engagement is also in the context of a broader kind of country-led strategy. So.
Great, thank you, Joanne. We've got time for one more question, and I would ask that if the members from the bank team could also give us kind of their final thoughts while they're responding to this question, because we're almost to 11:30 and we need to let them go. But then to remind everyone that to please stay on the line, and we will have some civil society discussion to kind of digest and think through some of the things that we've talked about this morning and any other issues that you may want to bring up. So we'll have another half an hour for that. So with that, the final question that we'll cover right now, although we will be posting the questions for input on our website, the question is, will the bank commit to ensuring that they will track resources that go through the GFF disaggregated by thematic area under RMNCAH? This should happen at the global and at the national levels. Tracking of global resources broken down by thematic area as well as at the national level. So Monique and Rama and Diane, could we get your input on that, please?
Yeah, hi, this is Monique, and this issue also came up in the Nairobi consultation, and so and this is part of the workarounds. And so I think one thing is really important to highlight is that the GFF Secretariat is hosted at the bank, but really represents the partnership. And so here, the focus of the partnership of ensuring tracking resources for RMNCH is going to be important, and it was an agenda point at the September meeting, and it will be an agenda point at the February meeting as well. And I think so that shows the commitment for that. A large challenge in that is when we started going through, and we're sharing all of these presentations will also become available online, but when we start looking at country level, there are very few governments, and none of them are GFF funded countries at the moment, that are able to disaggregate at the moment for that level of detail in terms of specificity where the financing is going. And so the majority of the challenge of this is not a partner or a bank commitment, but it's more the necessary investment that needs to be made on country level to track the use of these resources. And so that's something that will be discussed again in February, and we'll continue this piece of work that will involve mostly very hands-on work with countries to ensure that we have the data to report back on it.
Thanks, Monique. And actually, if I may, you have mentioned, well, it has been mentioned several times that the next investors group meeting is going to take place in February. And I believe that you've mentioned a few points that are going to be on the agenda. Is there any chance that the draft agenda will be shared ahead of time, or if people will have any opportunity to contribute to thinking around what that agenda will cover?
So, Joanne, do you want to come in on this?
Yes, hi. So we're busy iterating the agenda at the moment. I wouldn't say there's a huge amount of room for input, mostly because the agenda was very much driven by the outcomes of the previous investors group. So there were a lot of follow-up outcomes that were specifically requested to be discussed at the February meeting. So a lot of the agenda is driven by that. In addition, the chair of the investors group takes a strong role in defining what will happen, and because it is also a retreat, there are some items that she in particular wants the investors group to consider. So there's that discussion at the moment in terms of how we're laying out the agenda, but we'll certainly be sharing it in advance, probably in January, and I'm sure that both the chair and ourselves, we'd welcome comment and so on. But as I say, there's not a huge amount of room for debate because so much of this is already defined in the report of the previous investors group.
Great. Thank you so much, Diane. I know that people will look forward to being able to see the agenda ahead of time and think through how they might provide constructive commentary to hopefully make that investors group meeting as productive as possible. Joanne and Mesfin, did you have any comments on the question around financial tracking?
Just that I think it's really important and right on, in addition to tracking these resources disaggregated, also tracking additionality of resources, and so we'll certainly commit to playing a strong role in supporting that.
Great, thank you very much. So why don't I just ask Monique and Rama and Diane if you have any last thoughts you'd like to share before we move on to the next portion of this call. Monique, over to you.
Thank you, and thanks for organizing. I will particularly also thank the representatives on the investors group for the great collaboration, and thank the participants for their interest. I think 2015 was a year of a lot of momentum for the GFF, and I look very much forward for us to work even more closely together in 2016 to address some of the challenges we are facing and ensure that we really design and implement based on our mutual commitment to this agenda. So thanks for the opportunity today.
Hi, Christine, this is Rama. Sorry, my voice is completely abandoning me at this point, but I just wanted to echo the thanks that Monique said. I think we found this extremely fruitful, this engagement, and we are even more excited because in 2016 we're going to really be, the action is going to be at the country level, and that's where I think a lot of civil society's contributions will really come to the forefront. So we are really looking forward to that aspect, and obviously having a feedback loop so that there's information exchange as well as guidance and direction both ways. But I think for us, next year with the 12 countries moving forward will be extremely exciting, and look forward to working with everyone. Thank you.
Great. Thank you so much to Monique and Rama and Diane for joining us today. Wishing you happy holidays, and we will look forward to reconnecting in January with you for preparation for the investors group meeting and all the additional work that is ongoing. So thank you so much, and let me just remind everyone else, if you would like to stay on the line, we are going to continue discussion. We have about 25 minutes allocated for civil society discussion. And we have heard a lot from Joanne and Mesfin, and I want to thank both of them for being so willing to speak so much during this webinar. We may also have representatives, I'm not quite sure who's still called in, but we may have representatives from the Reproductive Health Supplies Coalition as well as from PMNCH on the line. So let me ask if Betsy McCallan or somebody from PMNCH or Susanna Dennis or Preeti is on the line and would like to give commentary right now. Please feel free to start us off, and then we can take any additional, we can get into additional discussion. And actually, you can raise your hand and we should be able to see you if all goes well. Oh, there's a hand. Okay, so let's start. Mati Jha is on the line, and Mati is the PMNCH representative in West Africa, based at Save the Children in Dakar. So Mati, over to you. We're trying to unmute you. Hold on. Click to unmute. Can you unmute everybody? Sorry, oh, you've got mute all done. Gosh, sorry, Mati, we're having trouble unmuting participants. I know that this is not ideal, but Mati, if you'd like to send in comments by chat, we can also share them that way. Sorry. Okay, Mati, I think we should be able to hear you now. Or not. Try that one. Wait, she sent in a chat. So Mati is just saying that she's sitting in on behalf of PMNCH, and she is available if there are questions that she can respond to. She said that that much has been covered by Mesfin. And I will just say that we have been coordinating closely with PMNCH around this because they are so closely involved as the supporting arm of the Every Woman, Every Child strategy. And so we have been trying to reduce duplication of effort and do this all together, and we were very pleased to work with Mati and Kadi and Robin and others from PMNCH since November on this civil society coordination. Can anybody hear us? Okay, Mati, I think we can hear you now. Do you want to say something?
Hello?
Yes, we can hear you.
Oh, hi.
Hi.
No, I just, most has been really covered by the bank, Mesfin and Joanne, and thanks to everyone. I'm just here on behalf of CADI and PMNCH. If anyone has a question, I will be glad to answer it, but I don't have any specific comments.
Maybe I'll just add also that PMNCH has really been supporting Mesfin and Joanne in their roles on the investors group, and PMNCH also has a seat on the investors group. So they've been playing that really key role. I want to share a comment that we've gotten from Susanna Dennis. Is that and Susanna is with PAI, but she also is very active on the Reproductive Health Supplies Coalition and has been doing a lot of really great work on the country platform minimum standards and around commodities and the need for financial tracking. So she wanted to underline the need for a very targeted CSO strategy with shared objectives. And I think that we've already had some discussion around that following the civil society pre-meeting on November 15th. There is discussion around how that can move forward. And I would just emphasize that one thing that we have been really discussing and wanting to make sure happens is that there is the possibility for civil society strategy at the country level, at the regional level, and at the global level, and that these different levels are connected and able to exchange and coordinate. The feeling being that we can't afford to have groups splintered by geographic location so that they are not benefiting from what's going on in other places and able to take advantage of the different discussions that are ongoing. Okay. I think Preeti is trying to call in. Preeti, you need to unmute. Is she able to do it? Otherwise, again, I'm happy to read it out loud. Let's see, I'll just read a comment that we've gotten from Esther Agbon, who says, I really want to commend the PMNCH team for ensuring that the pre-meeting agreements got buy-in from the investor group meeting. And I'll just add to that was something that we were very concerned about going into the organization of the civil society pre-meeting, was that the representation of the civil society representatives taking place in that pre-meeting be carried over into the learning event. There was some misalignment or disconnection between civil society representation within the country delegations that attended the learning event. But because of the pre-meeting, we were able to connect with some of those people who were on the country delegations, and there were additional civil society people going into, who were able to participate in the learning event. And so, as Esther points out, we really were able to bring forward a number of the recommendations, including the suggested minimum standards paper, into the learning event. And it got quite good traction, and I think everyone was encouraged by how much attention that particular piece was able to receive at the learning event. Esther is saying additionally that we need to keep a step ahead and review the actions of the investor group meeting, maybe when we can have another webinar for CSO before the meeting in February. Yes, indeed, that's something that we have discussed, and I know that Joanne and Mesfin previously have appreciated getting the opportunity to get contributions around people's perspectives before they go into these meetings. So I think that that's something that we will look to try to organize in late January or early February once we know more about the agenda and the documents that will be discussed at the investors group. Mesfin and Joanne, do you have any comments that you wanted to make around these various points that I've been covering from the chat room? What else to call it?
In the pre-learning as well as the main learning event. I think, as you pointed out, the people that attended in the pre-learning was meant to provide a space for as many civil society as possible to express their experience in terms of their engagement in the country platform. But you know, the process that was outlined was that the countries will choose their delegate that would go to the main learning event, and part of that was, you know, a civil society representative. So that civil society representative was selected by the, you know, primarily by the government, and many of the participants were able to come in the pre-learning event. And although they had limited understanding of their role in the country platform as a civil society representative, but by participating in the pre-learning event, I think it has helped them to understand their role. And when they went to the main learning event, actually they were pretty much well informed and prepared to speak out on behalf of civil society and the issues that has been faced by civil society in the country platform. So in a sense that, you know, the lack of transparency in terms of the selection process has put, you know, this representative in a difficult position. But once they understood their role, they were quite, you know, enthusiastic in terms of doing better job and be able to understand the whole GFA process and engage with their peers. In fact, the request that came out from this participant was, you know, how do you people and global partners, how can you support the countries, and what would be the mechanism for us to get information before the country meeting for us to be able to represent civil society meaningfully. So I think, you know, it helped in a way that generates momentum and understanding, even those that were selected by the government who didn't understand actually well their role. But I think both having the pre-learning and the main learning was helpful, you know, to bring alignment on that. I think going forward, we really need to look at how they would be supported, and in some way that they would also have a role in terms of representing their constituency, not necessarily participating in their individual capacity or their organization. So good, you know, things came out from the process, but again, you know, there was a bit of disconnection, and I think good lesson that we captured, and I think it will be informative for further engagement with the country team.
Thanks, Mesfin. Joanne, would you like to add anything? Joanne, we're having trouble hearing you. Can you speak louder? Oh, Joanne, I think you are muted. You've muted yourself. Can you unmute? While we're waiting for Joanne, I'm going to read another comment that we've gotten from Preeti Sundaram from IPPF. She says, as much as I agree with the bank's point around being cognizant about the national capacity of national governments to disaggregate financial spending by thematic area, civil society must continue to hold the bank to account on their responsibilities at the global level to monitor bank funding for RMNCAH that goes to recipient countries. They currently monitor spending on reproductive health, for example, although their reproductive health action plan, through their reproductive health action plan. So we need to ensure that responsibility is not shifted exclusively to national government's capacity to track health spending, as the bank should be able to monitor their spending for RMNCH at the global level. Moreover, it is hugely important to track resource flows to ensure that we have a good idea of what funding is new and additional. Susanna has also added that we reviewed the global strategy operational framework, and I was surprised to see GFF country platforms as the main way the updated global strategy is envisioned to roll out in countries. I want to raise this for folks to be aware of. I also want to see if there's anyone from PMNCH who can share more behind this decision. I think that that's probably a comment that we should take up in another discussion. I think that the connection between the strategy and the GFF and how it's rolling out at country level is very pertinent, and we don't have everybody from PMNCH on the line that we would like to. They had a couple of other things going on this week, but I think we'll take note of that and address it at another time.
Yeah, Christine, just maybe to comment on the previous point made by Preeti in terms of tracking financing. I think there is certainly work need to be done by the Secretariat or GFF in general. I think so far what we have heard is that the trust fund will have a result framework for tracking resource that is financed, that's coming through that from the trust fund. So in Nairobi meeting, they kind of alluded to the need for result framework for tracking or monitoring what's going on all in the GFF process, which is including a resource that's coming from outside the trust fund. But what they have been very clear is that they will be developing a result framework for tracking a result as well as financing for resource that's coming from the trust fund, which include the IDA leverage. So that's what we know at the moment. But I think we think that it should go beyond the trust fund IDA in terms of tracking a resource as well as a result, and it should look at the whole facility, not only those financed by the trust fund. So that is something that we have taken note of it, and we will continue to highlight and reinforce that to the technical working group.
Thanks, Mesfin.
This is Joanne. I think I've unmuted. I think I've unmuted myself now. Just really quickly, I would also just say I strongly agree with Preeti and the importance, and we will definitely push that, the importance of tracking the financing, both where it's going to and for, to the degree that it can be disaggregated. And I think, again, further disaggregation is in itself an advocacy strategy where possible to make sure that kind of key areas are being included, which is not to take away from the need for kind of broad health systems financing, but that's really important, and also tracking additionality. And as Mesfin said, also I think ensuring that in that results framework that there is also kind of, and this is part of I think what a country platform needs to do and what civil society would do, but some kind of independent verification on results as well seems like it will be really key. And then my only other point around I think it will be really important to get together via webinar and sort of other communication before the investors group meeting. And given that there will be key discussions around the country platforms and quality assurance and other areas, I think our advocacy as well with different members of the investors group. So we are one channel, but I think us collectively thinking about the other connections that we have to be building support within the investors group to strongly take forward the things that we see as priorities will be really important strategy after the new year.
Great, thank you, Joanne. I'm glad we got you off mute. There's a question that we received about country eligibility, and I just wanted to go over the countries that are currently being included in the GFF so that everybody knows what they are. The first 4 countries, which are usually referred to as the front countries, are Kenya, Tanzania, Ethiopia, and the Democratic Republic of Congo. In July, the bank announced that there were 8 additional countries being added, and those countries are Bangladesh, Cameroon, India, Liberia, Mozambique, Nigeria, Senegal, and Uganda. and those countries are referred to as the second wave countries. So if you did not hear your country in that list, it is not currently being included in the active GFF work that is going on, but there is a much larger group of countries that are considered eligible, and so presumably as this moves forward, and if the bank in fact is successful in mobilizing funding for this, then the list of active countries will presumably get longer. But the 12 countries that I just cited are the countries where active work is going on currently around GFF development. We have a question from Susanna Hurd from Global Health Visions, who asks, actually, Mesfin, this is for you. Is the results framework that Mesfin mentioned separate from the QA, the quality assurance framework, or are these the same? Mesfin, could you answer that? And then I'm going to go to another question that we've gotten, which is really critical to how civil society is organizing around this. So Mesfin, this question about the results framework?
Yeah, they are separate. So the result framework is basically looking at result in terms of achieved through the investment case and the financing, and the quality assurance is actually looking at the process of developing the investment case. So they are two separate things. Yeah, just the short answer.
Great, thank you. So looking at the clock, we have 5 minutes to go, and I think that this last question, well, it's not the last question. There are actually a number of questions that we haven't gotten to today, which we will be posting, but I think this particular question is very pertinent given the group that is on the call today. And Joanne and Mesfin, and if there are others who want to contribute via chat, please go ahead. So it's around how civil society is organizing. And the question is, perception of how CSOs are represented is crucial. Unfortunately, it is hard to represent a diverse group of actors, and selection is often not transparent. How can we ensure the image of representation, and I would add the process of representation, is made better and more transparent? Mesfin and Joanne, could we get your thoughts on that as kind of the last points in this particular discussion, and then we'll be closing up the webinar for today?
Yeah, I can go ahead, and Joanne can add. I think in terms of the civil society representation, perhaps we may have to look at it at different level. Certainly, civil societies are represented at the global level in the investors group and at the country level in the country platform. So, if I may start in terms of the global level, I think the process that has been outlined in the governance document is that PMNCH has taken a responsibility in terms of facilitating the selection of the civil society organization and the private sector representative in the investors group, as well as the PMNCH. Of course, the board chair is the one representing the PMNCH itself. So in that process, I think PMNCH, the civil society constituency within PMNCH specifically have been given that task in terms of selecting as well as supporting the civil society representation. So we have actually a strategy document we've drafted, which we'll go through it in the next call, I believe, somewhere in January, just to look at the process in terms of selection and as well as representation. And so far, civil society have been given 2 seats. So that process needs to be refined, and making sure that actually civil societies who can represent the constituency for the RMNCH are selected through their constituency. The same process applies at the country platform. And, so far, again, at the country platform, the best case scenario is that, constituency to select their representation, but that has not been the case. And, GFF itself has not recommended any particular approach for country platforms, so they encourage countries to use existing platform, which means anyone who is being part of the country, what they call it, existing platform is like in the case of, let's say, Ethiopia, they use the sector-wide approach they have been using. Would be whoever have been part of that process by default become, the civil society representative. And in Tanzania, the one plan process, and again, whoever has been part of that process has become, the civil society. Again, Mozambique also sector-wide approach they have been using. Uganda also sector-wide approach. So, in that process, anyone who has been participating previously or engaged in some way in whatever capacity become automatically representative. But I think taking a step back now in terms of going forward, selecting a representative that would represent the constituency we are talking about, including all the thematic areas, then that need to have a process. And I think that's where the minimum standard would help in terms of outlining what that process is going to look like. So those are the things that we are hoping would help in terms of clarifying some of the point that has been made here in terms of image or representation of the issues that included under the RMNCH agenda. I'll stop there. Maybe Joanne can complement. All right.
Yeah, and thanks for the question, because I think it's a really important one. And I think, Mesfin, you said it well around the country process, that the goal is that there would be a process. It's never going to be perfect, but where civil society representatives would be selected by constituency, and that would be true for, again, for private sector as well. So it's not, so it's more of a, to the degree it possibly can be, a constituency-led process. And then on the selection, it's sort of at the global level. I don't want to speak for PMNCH, but I know that there is work that's happening to define a process. Mesfin and I were selected for this first year in a kind of, this is sort of transition year for this investors group at the global level, and that there will be a more comprehensive process for selection of investors group representation going forward. And I know PMNCH is looking at and developing that process. I don't want to speak to the details, but I know that that will be a part of the process going forward. And I think the other critical thing in terms of helping us do an effective job of representation is having this real kind of core group of that includes leadership from the countries that are part of the GFF process, from key regional partners that are working on health budget work, and broadly supporting partners across regions, and then partners at the global level who have been very deeply engaged in this, like the reproductive health folks, that what we're representing is the thinking and the priorities of this larger group of civil society, kind of from the global to the national level. And that's why I agree with Suzanne as well, that it's really, really important that we sort of build out these structures, even if they're imperfect, as quickly as possible, and then have a really clear both kind of communications and coordination structure, but make sure it's smartly inclusive.
Great, thank you, Joanne. I think we're going to have to wrap this up. Just to say that we will try to organize another webinar in January or early February ahead of the investors group meeting. The investors group meeting is scheduled for the week of the 15th of February, if I understand correctly. And then just to say that we've mentioned a number of documents and referred to the minimum standards, et cetera. while on this call. I will say that one of the challenges we're having right now is that there is not a comprehensive website for GFF that is available with all of the documentation. It's something a number of us are working hard on. I would direct people, if you want to see the documentation, to refer to the Global Health Council website under the Advocacy Resource Hub. There are also a number of documents on the PMNCH website, as well as the World Bank GFF website. Not everything is necessarily there, and one of the things that was mentioned earlier, which we are certainly pushing for, is getting the investment cases up as quickly as possible, but some of this is still under construction. So with that, I am going to ask you also to keep an eye out. We will send out a post-webinar email that will contain links to the presentations, to the documents, to the websites, and that will be coming out probably in early January, or hopefully maybe before the end of this week. But in any case, that will also give you links to the resources that you want to refer to. With that, I'm going to thank all of our panelists, everyone who contributed a question or an observation. Thank you so much. I'm pleased that we're able to hold these kinds of convenings to bring people together around this. It's very important. And I will note that with each webinar that is organized, the numbers of people participating and the diversity of where they are located increases dramatically. So we are seeing that interest is increasing. We are seeing that people are really engaged in making sure that these questions are addressed and are integrated into how the GFF evolves and is implemented both at the national level and globally. So with that, I want to thank everyone and wish everyone a happy holiday season. And so we'll call it a day, and please stay safe and have a joyous holiday season with lots of peace and health.